Okay, we are here. Hello, everyone. Welcome to another episode of Weekly Hope. It's Kirsten Haglin here, and it's great to see you. I'm so glad that you are joining us because we had a little bit of a hiccup last week with our technology with Dr. Streno, and we had to reschedule to this week. So we are so glad that you are joining us, that you're back, and of course that Dr. Streno is back with us as well to dive into a great topic. Have a wonderful, hopefully educational, empowering, and inspiring conversation that will benefit you, your family, and your loved ones. And of course, we always on this show welcome your feedback, your comments, your questions to really make this a conversation. So that's what we do here at Weekly Hope. We invite guests like Dr. Streno on every week to discuss topics within the field of mental health, and in particular as they relate to eating disorders and people that struggle with disordered eating, body image issues, and weight. And so we just come on here and try to provide these expert interviews for you to be able to learn and hopefully grow wherever you are in the recovery process. And of course, then be able to share these videos as well with someone who might need to hear some encouraging words. So that's a little bit about who we are. Like I said, my name is Kirsten. I'm going to introduce our guest who's sitting over there in just a minute. And I've been in Germany for the last couple of weeks, but I'm back in Zurich, which means this little fluff ball is also back. For those of you who tune into our show, you know that this is Elsa. She says hello. She's my unofficial co-host of the show. And she is also my model of living imperfectly and embracing your imperfections, as she is an alte Dame, as we say in German. She's a little old lady, and she has no more teeth, and her tongue hangs out. So she always sits on my lap during the show and reminds me that no matter what happens, whether it's technology or something else, that to be perfectly imperfect is okay. We're all imperfect, and that's what makes life beautiful and special. So anyway, Elsa says hello. She's going to be sleeping down here for the show. Anyway, so glad to have you, and I would like to welcome our guests so we can get into our conversation. So we have this week Dr. Melissa Streno joining us from ED Care Denver, and she is joining us from Denver today. That's correct, right?
Yep, I'm here.
So I am going to read a little bit of her bio first so that you can all get an idea of her area of expertise, and then we will jump in. So Dr. Streno graduated from the University of Colorado at Boulder with a BA in psychology. After gaining experience at Children's Hospital Colorado working with eating disorders, as well as emotional and behavioral disorders, she attended the University of Denver and earned her master's in sport and performance psychology. Combining her own experiences as a competitive athlete and a strong desire to help those struggling with their own mental health, specifically eating disorders, she pursued her PsyD at the University of Denver. She completed her pre-doctoral internship at the University of Oklahoma, training within the Psychological Resources for Student Athletes Office and the University Counseling Center. Dr. Streno is a licensed psychologist in the state of Colorado. And Dr. Streno, tell us, what is your specific role at ED Care?
Yeah, so I'm a primary therapist at ED Care, and in addition to my primary role, we also have an athlete track, which is a program specific to athletes who are struggling with eating disorders. So we have a wonderful team of providers and clinicians here, and I help to lead that program here.
Wonderful, cool. I already see Elena says, hi, everyone. Hi, Elena, it's great to see you. And that just gives me the opportunity to just say, please come on, leave in the comments, say hello, let us know where you're signing in from. We love to hear from you, and do not be shy with your comments and questions. This is a super safe place, and often in the comment sections, we get really wonderful stories, voices, and encouragement from other people. So feel free to jump in at any time. I'm watching the comments, so if you have a question or just want to say hi, feel free at any time. So Dr. Streno, first of all, since we're going to be tackling the athlete identity as it relates to eating disorders, and in particular transitions for athletes, want to first just very basically ask you, how common are eating disorders among athletes?
Yeah, actually a lot more common than I think many people think. Just, to give you more of a statistic, I think it was last year, NIDA released the statistic that I think most out of female athletes, around 60% struggle with either an eating disorder or eating disordered behaviors. And then males is between 30 and 33%, which is relatively high considering what most people think. Most recently, I think it was the the 2019 consensus statement also showed that amongst college athletes, between 10 and 24% struggle with both depression and eating disorders. So if you think about what this would look like on your team or with your friends, I mean, that's 1 in 4 of your friends struggles with this very, very debilitating, devastating illness. And, you know, within sport, there's a lot of risk factors that put athletes at a much higher predisposition to struggling with this and to developing a full-blown eating disorder as well. So it is very common. I think there's kind of debate is, are more people struggling now, or are more people just coming forward and speaking up, which is wonderful, and hopefully it continues in that direction. And I think it's a little bit of both. So I think the numbers are probably higher for both reasons.
Yeah, and it's not just those sports where body aesthetic is a part of the competition or the configuration, right? When trying to become a good athlete. I think that's a misconception, is people think, oh yeah, athletes struggle, but that's only figure skaters or gymnasts.
Yeah, absolutely. Which would also limit it to females. And like I said earlier, this is for everyone, female, male, transgender. But yeah, there's a ton of research on the aesthetic, lean, weight class sports that would definitely predispose somebody to developing an eating disorder. And we do see higher numbers in those sports, but yes, this is common at all sports, at all levels, at all positions as well. I think there's definitely a misconception that this wouldn't happen to football or more of the men's sports or anything like that, and it's definitely not true. So this is definitely not just for the aesthetic sports that have more of the judgment kind of evaluation component, that this is across the board. We work here with athletes from all performance realms at all levels, like I said. So.
Yeah, and I just want to mention that we did a Facebook Live interview with Mike Margema, actually, who was the professional baseball player, pitcher for the Seattle Mariners, who came out, was very vocal about his struggle with an eating disorder. There's also been, I think, a couple football players who have spoken out about their struggles, and these are really incredible stories, and it's so encouraging to see more people, especially men, come out and share their stories. Let's talk about transitions for athletes. How do those in particular influence an athlete's identity, and how might they be a potentially triggering time for an eating disorder?
Yeah, this is a really good question, and definitely I think something in this field, both in sport performance psychology, but also combined with the clinical piece of eating disorders, that's people are starting to look into a little bit more, which is great. It depends on the transition. So we can, when I conceptualize transition for athletes, there's the ones that are expected and planned to an extent, that maybe you finish your 4 years as an athlete and you graduate and you're not going to go on, you're not going to go train for the next quad in the Olympics, or go professional, you're done. So there's kind of a planned graduation and retirement from sport. And then we also have those that are totally unexpected, uncontrollable, injury, medical disqualification, often for eating disorders, that often leave somebody feeling very lost, very directionless, very alone. And I think that can happen for both, but it definitely depends on the type of transition. If you think about it as well, athletes, especially at the college level, once they get there, they're inundated with support. So from day one, and having worked in an athletic department and kind of seen all of the support and the athletic support, trainers, strength and conditioning, to the academic support, they are just inundated and often don't really know what to do with all of this. And then they go through their career, and again, like I said, whether it's planned or it's something totally unexpected, it's like they're pushed off a cliff. They have no idea what to do. They feel, like I said earlier, just completely on this island by themselves. And that is a time where we're seeing a lot of people turn to what they've been told, what they've seen, and think is normal, because it's been all around them. They're surrounded by it in terms of rigidity with food and exercise and schedule and all of that. And that's the one thing that they feel like they still can control. And so we see a lot of eating disorder behaviors, a lot of body image distress, and then full-blown diagnosable eating disorders develop post-transition. And that can also be influenced by those who are maybe struggling prior to the transition out of sport, and it just hasn't been identified yet because, like I said earlier, it's just viewed as such a sport cultural norm. There's certain behaviors that around competition time, just seem normal because that's what everyone does. Maybe it's influenced by the coach or the language the coaches use. The other piece is the shift in body image that, somebody's been training for maybe since they were 3 and specialized in a sport, and that's all they know. And their set weight or what they're used to in terms of what their body can do for them is going to shift a lot when they're no longer competing, training at that caliber. And so we see a lot of fear, of course, and then also just this disconnect with who that person is, and that's very connected to their identity. They just feel completely lost and wonder, who am I? What do I do now? What do I do in relationships without sport? And so again, another time to kind of regain that control, to be familiar and to be comfortable with behaviors that were prominent when they were in sport is something that they go back to, and can unfortunately lead to having an eating disorder.
And I think too, I don't know what it would be like for an athlete, but I know what it was like as a dancer.
Yep.
But it seems to me as well that so much of your identity is wrapped up. I mean, even just outside of how it makes your body look, so much of your identity is wrapped up in the sport. So then when you're transitioning out of it potentially, or even transitioning to the next level or leaving a certain team or something behind, that loss of like emotional location, or like your identity location leaves. I mean, I just can't even imagine how difficult that would be, especially for someone competing at a very, very high level, that at what risk that puts someone.
Yeah. Well, and I absolutely, you hit the nail on the head as far as the emotional piece too, that if somebody has been used to being in such a team environment where they're surrounded by what is often kind of their second family, and for some people feels like becomes their first family with coaches and teammates, etc. When that's not there and they're forced to live, quote, normal life, and have to either go to grad school or get a job and have to work with coworkers, and the routine is totally different. They're not getting up for 2-a-days. They're not going to lift in the mornings and then go to class and then see an academic advisor. They are just doing an 8 to 5. And it's like they're having to rewrite their whole schedule, but also who they are. Like, how do I fit into this new routine? And so, like I said earlier, oftentimes one of the things that feels so familiar, comfortable, a temporary relief is using mismanagement of food or exercise. And sometimes it's not intentional. It's all they know as well, too. So we have to hold that as well. But that definitely plays a big part.
I'd love to ask you if you're comfortable with sharing. In your bio, you talked about your own love of sports and, all of that. How does your personal experience within the athletic community help you, especially I would imagine in working with clients, and to navigate some of these transitions? I would imagine that having someone to talk to who kind of has been in this world a little bit is incredibly helpful.
Yeah. This is very close to home for me. I played lacrosse in college and was very used to coaches telling me what to do in terms of, exercise and, traveling, what to eat, etc. And then after I graduated, I felt completely kind of lost and without any sort of structure in terms of movement and activity with my body. That was something that from a very young age, my parents just kind of instilled, and we were in a variety of sports, and I always loved sports just for the fun piece. It was never something I felt like I had to do, and loved doing it. But after college, when that encouragement, that structure wasn't really there, I needed something, to pick up. And I ended up picking up marathon running, which looking back I loved it. It was great. I don't run marathons still now, but I definitely understand, what that isolation and that just feeling completely lost and not quite sure where to go and what to do in terms of exercise and activity and all of that. And so I think my experience of being in that situation and being able to relate to a lot of what my patients and clients are going through, I think is helpful. I definitely, I get what they're going through. So
yeah, and
to redefine my direction.
Yeah, and speaking of that leads me to my next question, which is, so how can an individual prepare for a time of transition? Let's start first with, because you said you replaced lacrosse with something else. You found something else to do to give you structure and that you also enjoyed. I think.
Yeah.
I would not enjoy marathon running.
Yeah, I did like it. Yeah, but I think it's important to note too. I think part of preparing, especially when, like you said, replacing, is not making it everything again. It wasn't necessarily a replacement for exercise, marathon running, and I mean, I was doing that in addition to club lacrosse and hiking and skiing and, you know, things that I just found a lot of joy in. And so I think there has to be a really good balance. And for athletes to be able to learn that that's going to be helpful and useful when they're in sport, that's a really hard thing to understand, because in that moment, their focus, their main goal, their intentions is solely on how do I win, because that's what they're getting from their coach. That's the feedback and the encouragement. And so I approach it with the current athletes as, if we can give them as much information as we know in terms of what this potentially is going to look like, how you're going to feel based on what we've experienced with other people before, at least we know that when they endure that transition, they have that information and they can be the ones to determine when they use it. So when they know, or when they decide that they want to use the resources that are available to help them navigate that transition. Or when they want to utilize, you know, working with a dietitian on how do I fuel my body now that I'm not working out 4 to 6 hours a day? How do I find my set point? That kind of thing. So I think we can inundate and overwhelm them with information. And I think institutions, organizations are doing a much better job of that. But it's letting them know that there is going to be support for them during that transition. And then once they're transitioned out of sport and kind of on their own.
Yeah. I'd love to ask you how to prepare well for that transition out, but also the transition, say and we usually get a lot of parents who are watching and
Yeah.
You know, their teenager, for example. How can a parent, loved one, family member, or the individual themselves prepare for that transition, say from maybe high school to college, or college to amateur, or, you know, professional? So that kind of transition up.
Mm-hmm. So prepare for it in the sense of helping them navigate just what that shift in identity is going to be like, that shift in routine.
Exactly. To prevent, obviously that would be the goal, prevent disordered eating behaviors.
Yeah. I think one of the most important things to think about from a friend, family member, parent, especially, is recognizing what you role model to that person. So you could have, you know, your 100% intention is to make sure that your child remains healthy and fuels their body right, and doesn't overdo it and doesn't burn out. But being aware of how you talk about your own body, the language that you use, the behaviors, all of that is so important. So I think because they're really, when it comes to what parents and their level of influence is, there is a limit in terms of what they're going to be told once they're under a coach or a team athletic department. So I think that's one thing that's definitely within a friend, parent, support person's role, or within their control. I also think, kind of like what I mentioned before, and just letting them know that there are tons of resources. There's lots of support. There are people you can talk to. It's probably going to be something that's common and normal for a lot of your teammates to be experiencing as well. So just the idea that you're not alone in this transition, that it's likely going to be scary, it's change, but it could also be really exciting. And so I think just letting them know that you're there for them, you're there to listen, you're there to help them find resources when they need it, if they need it, I think is a good kind of preemptive approach before somebody makes that transition. Sometimes they just need someone to listen and just to validate how hard the transition is, and not overreact and not all of a sudden inundate them with support that maybe they're not ready to access yet too. So I say, you know, follow their lead, but let them know that you're there. And of course, if you're concerned, there's obviously, especially in high school and college, I think there's a lot of support at the institutional level too. So don't let them take too much of a lead.
Would you also encourage family members or friends or the person themselves to not, this is something that I would have told my younger self, because the world so positively reinforces people who devote their entire life to something. They're 100% in, you know, 100% commitment, nothing else. And I got a lot of positive reinforcement as a ballet dancer that was all I did in my life, and I had no other life, basically. And it wasn't until I got into recovery that I started to really branch out and do more things. And I would have told a younger version of myself also, along with all that good stuff that you just said, to do other things. Like, I can be very committed and, you know, very devoted and working very hard at my sport, at my thing, but also do other things that I enjoy. so that I could have diversified my identity a little bit.
Yeah. Yeah, I think it's definitely very important to remind them that their athletic identity is really only one part of who they are. That sport is only one part of their identity. And I think, like you mentioned, and we see that all the time, is that when that's all you know from a very young age, that feels like that is your life. And so helping them from a young age, or once they're in high school or when they're in college, to branch out, to try different things, kind of putting the bug in their ear that, when sport is over, because sport will end at some point, you're going to want them to find something else that they're really passionate about, that they find joy in. And so to be able to find that before sport ends, and to have some sort of overlap, and to kind of diversify their experiences and find other interests and find other passions. One thing that kind of comes to mind is I was thinking about a consultation I was doing yesterday. I think when people do that, also for those who are struggling with an eating disorder, that's often when they realize how much they actually don't like sport, or how much they actually don't like exercise, or what they're doing that they think is so good for their body too, is that they feel like that's all they know, and so that's all they can keep doing. But I think when people find other experiences and find things outside of exercise, I think it can be very healing and a really big part of recovery as well. So it doesn't always happen that way, and I'm not at all saying that you can't continue sport if you're struggling with an eating disorder, but we do see that happen, that they just realize how enabling that movement, that sport, that activity actually is to their illness. So
That's so
be
good.
very powerful.
Such a good point. I just want to say that if you guys have got questions, to make sure that you dive in and ask us. We've got some new people on here in a while. I just want to say hello and welcome, and let us know where you're signing in from. Say hello, tell us your name, and if you got any questions for Dr. Streno, make sure to jump in anytime. Feel free. Let's talk a little bit about then that transition, maybe down from a sport, which we did a little bit. Maybe for someone who is in the recovery process, how do they make sure that they're staying in their recovery process well, that they're doing this? What is the process for that person look like, and what tips can you give them for someone transitioning out of this sport? Like 3 very practical tips for someone who is going through that time and is in recovery.
Who's in recovery already? Yeah, I think one is you reminding yourself that you know yourself best. When some of those urges, those thoughts, that desire to resort to something familiar and comfortable, what that feels like. So be aware of your warning signs, your own symptoms. It's going to be different for everybody, but there's also definitely overlap. So catch it early, like know who you can go to for support, because clearly if you're in recovery, you've been able to do that before. The other thing I think is reminding yourself that you're not alone, that there are many people who are going through this every single day. There are people who are in treatment going through it, and there are tons of people who are excited and passionate to help people who are going through this. And I think often there's the misconception that once you're in recovery that you've got it and you just kind of move on from your life. And I think some of the hardest phases of recovery come years later, when either you're triggered by something, or you miss something, or there's just then that kind of grief and loss of sport and athletic identity and what that lifestyle was like, and teammates and all of that. So know that there's never like an end point in this. You can always be reaching out to people, talking to people, joining support groups. And then the other thing I think that's really important is, earlier we were talking about how your sport sport is just one component of your identity. It also doesn't mean that once you're done with sport, you have to get rid of that's actually helped you be successful in so many areas of your life. And some of the traits that come along with that, I think Ron Thompson and Roberta Sherman, coined these good athlete traits, which is so important, that those things have helped athletes be so successful. The compulsivity at times, the obsessiveness, the coachability, all of those things. So reminding yourself that you have all of these great tools. You don't have to get rid of them. You can use them in other areas of your life as well. So you don't have to, sport and athleticism and all that does not have to fully disappear. I think there's other ways to use it in a healthful, more appropriate way that keeps you in an authentic life.
Oh, so good. I just want to say, Becca, I saw your comment there, so I don't know if I have a way to turn my volume up, but I will just talk louder. How about that? I don't know if I have a way to turn my microphone up, but I can just talk louder. I can project more. Use my singing skills that I learned. See, I might not have obsessive or linebacker qualities, but I do have my singing voice still. So how, I would love to ask you this question, and I have heard some debate about the incorporation of exercise movement into the recovery process for people who are very ill, because it maybe has been used or abused in the past. Can someone continue to do their sport while they are in treatment? Obviously, I know if someone's in residential treatment, that maybe can be a little bit interesting, but what is your philosophy on incorporating that person's sport into their treatment process?
I am a full supporter of it, definitely a proponent. And we do that here. And I think we've spent a lot of time looking at definitely some of the research that supports why that is really helpful. But also if you do it appropriately and do it correctly, I think it can actually be life-saving in the sense of helping somebody recover from the eating disorder, just because of what I mentioned earlier, that, you know, taking away sport when that's all that someone knows can actually just be so traumatic. It's such a loss, and there's such a grief of everything that sport involves and relates to. So yes, I fully support it. Like I said earlier, and I think, well, there's a couple things. One is, I think Cook, who has fantastic guidelines around how you incorporate exercise into treatment, I believe was maybe part of this show not too long ago.
Right.
I think I saw something on here. Yes. Yeah. And so that his work is actually, it's fantastic. We mirror a lot of his recommendations in terms of when you're including sport and exercise into treatment of an eating disorder recovery, being very mindful. So for instance, here at ED Care in our athlete track, the first 2 weeks, anybody who's here, they're not doing any type of exercise, any type of movement activity. And that's standard for any patient who enters our program at the partial hospitalization level. And there's definitely some strong intention behind that. One is, our goal is always to treat the eating disorder. So yes, it's fantastic if we can also help them return to sport in a healthier, recovered place. But the first goal is always to treat the eating disorder. So those first 2 weeks, they're completely at rest. And they're also not doing any of the sports like groups or anything like that. After the first 2 weeks as a team, we assess how they're doing with meal completion, how all their biometrics are looking, labs. Our medical director is great, and she does a full assessment on readiness to return to any level of activity. I would say 2 weeks is extremely early. It's very rare that anybody starts any activity at that point, but eventually, and it's different for every person, and kind of their individualized, tailored treatment plan, they very gradually start to incorporate yoga, mindful walks, stretching, and then with progress, and like I said, very close monitoring by all members of the treatment team, so by our dietitian, our medical director, milieu therapist, family, myself as a primary therapist, we all determine if this feels appropriate. Is this enabling their eating disorder, or does it feel like they're reintegrating exercise in a way that's healthy, that's appropriate, and that most importantly is going to be long lasting and a hopeful prognosis with their recovery. So it's to kind of sum up everything that I've said, I think it's absolutely essential for the athletic identity component. But also, I think you just have to do it very carefully, and it's going to be different for every person. So being upfront with any of our patients who come in from the start and letting them know that this is our goal, but we can't guarantee this. It's going to be balls in your court. You kind of decide what treatment looks like. And if you're ready to make some pretty significant changes and move away from the eating disorder, then incorporating exercise and helping you define that in a different way, redefining what movement looks like is definitely possible.
So good. Thank you for sharing that. And I think it's important too for athletes and some parents or coaches of athletes to hear that just because someone goes to treatment for an eating disorder doesn't mean that they're quitting necessarily.
Mm-hmm.
It might, just like you mentioned, some people discover that, hey, I actually don't really like this. But it doesn't have to mean that, right, at all. So absolutely. I think there's a lot of fear, initial fear of treatment for that regard. So I think it's helpful to know. Yeah. Denisa has a great question. And Ashley says, hey, ladies. Hey, Ashley. Denisa has a great question. She asks, what's the most effective way you've found navigating the relationship with coaches when athletes have to be pulled from the activity during treatment?
Yeah, that's a really good question too. And I think the first thing we always think about is if the athlete wants the coach involved in their treatment. So it kind of depends on how they were funneled to us. If they were mandated by their team or by the coach, or often it's by the sports med physician in their athletic department. If they were mandated, then they clearly know that they're at treatment, but the athlete still has a say when it comes to confidentiality and how much information shared, if any at all, or if there's any contact from any of the treatment team members with their coach or with their trainer at that time. So if they are willing, I think it can be so helpful to have the coach or the trainer. And I say trainer because they are the eyes with the athlete. They are there all the time. And having worked in an athletic department, that's where I got so much great information about the athletes, because they're with them all day while they're training, when they're traveling, etc. So having the trainer, the strength and conditioning coach, and then the head coach, often the assistant coach, having them involved can be really helpful from the start. And I think it helps them understand kind of our philosophy and treatment, but then also once they're getting ready to have this athlete come back to the team, if that's what we clinically and medically feel like is appropriate, that they're on board, that this is not just all of a sudden they're inundated with information from months of an athlete being in treatment, but they feel like they've kind of been informed along the way and they're prepared to help make whatever modifications, mandates, check-ins, whatever we are recommending as a team and working in conjunction with them can be really helpful. So yes, I would love it if all coaches were that on board and involved and encouraging of an athlete stepping out. But there's also the reality that coaches want their team to do well. And I think they also really care about the health of their athletes. They do. But it can be really hard for a coach to lose a player who might be a key player that year and have them go away and not be part of that team. And so some coaches are very involved and others aren't. So.
Yeah. Great advice. And thanks, Denise, for the great question. I've just got 2 more questions left for Dr. Streno. So if anyone out there is watching and wants to jump in with another question, this is your last opportunity. So I just want to let you know. So a second to last question is, if you are a coach or a parent or a loved one and you see warning signs and you think something might be up, how would you encourage that person to talk to the individual who they think might be struggling?
Yeah, I think the first thing is coming at it from a very, and this is hard because of course I think anybody in this position, especially probably a parent or a teammate, would be incredibly scared, and this would be really shocking, and there's probably a lot of fear behind this, but to be very compassionate, very, very empathetic, and just letting that person know that you are concerned, that you're recognizing certain things, and at times it's not even helpful to be really specific, but just to start from kind of a general approach of, here's some things I'm worried about. Do you need help? Do you want to talk to somebody? How can I help you do that? And then I think from there, depending on the severity, and also with an eating disorder, we know they thrive on secrecy. And so often when people are questioned, it only makes them want to regain a little bit more control and become more secretive and hide more of their behaviors and isolate more too. So I think there's a really fine balance in doing that. But I think getting them connected with any type of support you can. And then at some point, if it becomes where they're not getting the help that they need or not willing to do that, as a parent and as a coach, I think it's important to step in and really assess medically, are they stable enough? Can they keep doing this? Or do we need to put some sort of limits or boundaries or expectations on them taking care of their health in order to continue and to continue competing? And again, that's kind of a general piece of advice, and hard to, hard to say that that's going to be the exact same approach for a coach and for a parent, just because there's difference in background and emotional connection and all of that, of course. But I think I would recommend starting from a very gentle approach, letting them know, like I said earlier, that there's support there when they're ready. And then if you need to, probably setting a little bit more firm boundaries, limits, expectations. I know at schools they'll do like behavioral contracts or consistent kind of biometric checks just to keep the medical stability and peace in mind as well, and make sure that their athletes are safe. Ultimately, that's the goal. So,
yeah, great answer. And Rachel has a question. She asks, what are your thoughts regarding body composition testing for student athletes at the college level or college setting? If you could determine the policy of frequency and the communication of results, what would you recommend?
If I could do what with the results? What was that last part?
Like, if you could determine the policy of the frequency and the communication of results? So what would you
Yeah, such a good question. And the good news is it is shifting. I haven't been in an athletic department in a couple of years, so it could have shifted even more. And I'm just unaware because that's more kind of on the dietary, either the dietitian or the nutritionist at the university. But I will say that is absolutely can be a significant risk factor in somebody developing an eating disorder or eating disorder behaviors when they are going through like the bod pod or any type of bioimpedance or any type of body fat measurement, and that it's that it's taken weekly, weights as well. Anything that's potentially defining this athlete by these numbers is giving those numbers so much power and control. And we know that that's something that very, very easily can lead to an eating disorder. So I have seen a lot of trainers, dietitians, teams, schools trying to move away from that, which I am in full support of. I think there's many other ways and definitely more accurate ways too. I think there's probably a lot of research out there that shows that these aren't always the most accurate methods of measuring that are actually taking place. But I think there are many other ways to measure stability and kind of where they're at, and also to reflect to athletes that you are not defined by your weight, that there are so many other things that we are looking at and that make up who you are. So I am a full supporter of moving away from that completely. Obviously, there are situations where, we need, in treatment settings, I'll say, we need, for insurance purposes as well, we need specific numbers. And that's a little bit harder to navigate. But if it is a situation where it doesn't have to be used, if it's just for somebody who's not struggling and clearly knows how to fuel their body and to exercise appropriately and take good care of themselves, that I definitely don't think it's something that needs to be implemented.
Yeah, okay, thank you. And Tanya says, yeah, great question. This was a catalyst to my disordered eating in college. So yeah, that's obviously an issue that needs to be addressed. And I would say too, especially if you're a parent, but also if you're a student and you've had an experience with an eating disorder or have watched a friend go through one, I would also use your voice and say, hey, why do we really need this? Why is this really important? Question it, talk to someone, get someone from the counseling staff on campus or something to go and educate and be like, hey, this is what putting all these numbers in front of your athletes' faces all the time is going to do to them long term. So if you really care about their long-term performance and health, you should probably not be doing this, or do it in a different way.
Yeah. And I always say it's okay to ask why they're doing it. You always have the right to know the reasons why, or to at least ask. And sometimes that might give clarification or understanding if there is a very specific legitimate reason. But I think overall, and I think like what some of the viewers are talking about and mentioning, and what a lot of us have experienced, would indicate that this is actually really unhelpful.
Yeah. Cool. Great questions, guys. Thanks so much for chiming in. And I know that's really helpful because Rachel is, as we experienced, these are things that other people have on their mind too. So it's so great when you guys chime in. Dr. Streno, last question for you. And that is, if someone is really struggling right now in their recovery, what encouragement or advice could you give them?
Yeah, I think I mentioned this a little bit earlier, is I think in a time of struggling and kind of making the decision of whether or not to seek help or even see what type of help is out there, that remembering that you're not alone, that you're not on this island by yourself. I will say that you are the only person who can make the choice to get well. So there's a lot of people who are going to be your containers of support and who are going to help you and, hopefully create a really positive, hopeful framework for getting well. But ultimately it comes down to you deciding how you want to live life in your shoes every day. And so I always say you won't know what it's like until you give it a try. So at least give it a try. You can always go back to what you feel like right now is comfortable, but at least give it a try before you make that decision.
Such wonderful words of wisdom. Thank you so
Thank you for having me. This has been wonderful.
For joining us. This has been a really educational conversation, and thank all of you for watching as well. And want to encourage you to share this if you have an athlete in your life, if you yourself are an athlete and have a team, and maybe you want a sneaky way to talk about these issues more with your team. You can be like, hey, just watch this Facebook Live and here's the link. But feel free to download and share this. It's going to be on our videos page, on our Facebook page, as well as posted on our ED Hope YouTube channel as well. So you can go back and watch it anytime. And of course, check out ED Care's Athlete Track. Eating disorder care is in Denver, but they also have locations in Kansas City. And Dr. Streno, where else does ED Care have locations?
Yeah, so we're also in Colorado Springs, which is in south of Denver in Colorado. And then we also are in Lincoln, Nebraska.
Okay, perfect. So Denver, Colorado Springs, Lincoln, Nebraska, and Kansas City. But obviously, if you're someone who this has been meaningful to you and you think, hey, I want to get help, now's your chance, and here's the place to reach out. So, and ED Care I've seen has also been in the comments. So you have a link right there to their Facebook page. And Rachel says, thank you. That was the backup I was looking for. I'm an RD for college athletes and pushing back on body comp testing frequently.
Yes, well, thank you, Rachel, for the work you do.
Yeah, way to go. All right, wonderful. Well, thank you, Dr. Streno, from the bottom of our hearts here at Eating Disorder Hope. And thank all of you for watching. And we will see you. We are TBD on next week for our next episode of Weekly Hope. We may be here. It might be another week. I will definitely let you know. So, of course, keep it tuned to our Facebook page, Twitter, and Instagram, and we'll let you know. But we will always be back here to serve you and invite you to be a part of the conversation. Hope you're doing well and having a blessed day wherever you are in the world. And we will see you soon. All right. Bye, everyone.
Bye.